If you've undergone a prostatectomy for prostate cancer and you're now experiencing leaking during intimate moments, you're not alone, and there are ways to manage this. I'm Dr. Alex Hill. I'm a board-certified physical therapist. I specialize in oncology and pelvic health, and today I'm here to share some insights into climacturia, which is when you leak during that peak moment during intimacy, plus the available treatments to help you not leak. Climacturia can be a sensitive and sometimes unexpected side effect following a prostatectomy. It's a condition where there's an involuntary urinary leakage during orgasm. So just to briefly go through some anatomy, we have here the bladder, we have the prostate, and then we have the urethra. With the prostatectomy, that prostate and surrounding structures are removed, and then that urethra is brought up to the base of the bladder. During a prostatectomy, some of these muscles that control the urine can get removed or damaged. And so we're really relying a lot on the pelvic floor muscles to help with controlling that urine. So coming back to climacturia, when somebody ejaculates, the bladder also reflexively contracts. And if those internal sphincters have been damaged, then this bladder contraction can lead to a loss of urine during climax. Climacturia occurs in around 30% of people who have had a prostatectomy, and the mechanism of why people develop it after prostatectomy is unclear, but it could be due to that shorter urethral length after the prostatectomy, the removal of that internal urethral sphincter during prostatectomy in conjunction with that urethral relaxation, or due to dysfunction on the inside part of that urethra closure because of injury during the prostatectomy. That shorter urethral length and damage or removal of those muscles is normal during a prostatectomy, so it's not that anything went wrong. But again, this can be something that happens after a prostatectomy. But regardless of why it happens, it's pretty bothersome and annoying. So let's go ahead and talk about what you can actually do about it. So first, a simple but effective starting point to manage climacturia is to simply empty your bladder before any sexual activity, whether it's solo or with a partner, and also wear a condom that can help contain any leakage and make that experience less stressful. Next, you can try a penile tension loop or a soft silicone occlusion loop. This is a device that can be placed at the base of the penis. As you can see with this model, that urethra is at the bottom part of the penis. So when you place that loop on and give it the tension, the pressure going upwards at the base of the penis can give some compression to the urethra so that you don't leak. Be mindful to not pull it too tight, or you could have discomfort, pain, or bruising. Also, do not use a rubber band, hair elastic, or anything else super stretchy. These are going to squeeze way too much. Now, with these tension loops, if you're using lubricant with your partner, you wanna make sure that you're using a water-based lubricant like this one from Good Clean Love. That's going to help make sure that the material stays intact and it's not going to break down over time. Some other precautions are you don't want to use these bands if you have any type of anatomical change to your penis, and you also don't want to use them if you're on blood thinners or if you have decreased sensation in the penis or you have pain in the penis. Always talk with your medical provider first before you try one of these tension loops. Now, although these tension loops can be helpful, when you talk to people who've used them or you look at reviews online, they can be a little uncomfortable or get stretched out and not last for a very long time. If you are interested in trying one, I do have a link in the description below for my Amazon storefront where you can get yours to try it out. Next up is working with a pelvic health physical therapist. So since that internal urethral sphincter isn't working like it should to control the urine, you can retrain your pelvic floor muscles to help with not leaking. Working with a pelvic health physical therapist can provide you with tailored pelvic floor exercises and techniques to strengthen and improve the coordination of the muscles involved in urinary control and sexual function. So for example, as you get closer to climax, contracting your pelvic floor muscles to control that urine can be helpful, but a personalized approach can be incredibly beneficial. If you want to get started on pelvic floor exercises, keep watching until the end of this video. You can click on the video where I guide you through exactly how to do pelvic floor contractions correctly. I'm also linking resources below in the description to help you find a pelvic PT near you. All right, last up is surgery. So if you find that you have persistent severe leakage, you've tried all these other treatments, you've gone through pelvic pelvic health physical therapy, it might be worth talking with your medical provider about surgical options. Different surgeries that are available include an artificial urethral sphincter, a urethral sling, or a mini Jupette graft, which can also help with erectile dysfunction that commonly occurs after prostatectomy. So if you're having leakage with intimacy, just remember that you're not alone and treatment is available. Talk with your medical provider about what your treatment options are so that you can get back to intimacy and enjoy it. If you found this video helpful, please give it a like and don't forget to subscribe for more pelvic health and oncology videos.